Now we'd like to welcome an absolute leader and pioneer in functional medicine from the US, Dr. Jill Carnahan. She's the founder of and medical director of Flatiron Functional Medicine. Her personal health journey, surviving breast cancer, Crohn's disease, and toxic mold illness, has been the catalyst for her memoir and to empower patients worldwide. She's giving away free books tomorrow, Saturday at 11 a.m. at the Doctor's Data stand. And Jill is an absolute pioneer in functional medicine. She's a leader. She has an incredible podcast called Resiliency Radio, which has over 450,000 subscribers on YouTube. And she's just a force in our industry, and we're very, very lucky to have her. Thank you, Jill.
Thank you. Thank you so much, Kiki and organizers. Unlike James, I am going to try to overwhelm you. A few years ago, get the clicker here. A few years ago, a 35-year-old patient named Deanna came to see me. She was a bright young entrepreneur, and she had begun struggling a few months prior with crushing anxiety, obsessive thoughts, and insomnia. And it was affecting her ability to work. Her gut symptoms included diarrhea, constipation alternating, bloating, and gas. And as you can imagine, she had been given psychiatric medications that didn't work at all. She told me, "I think I'm going crazy." Of course, as a functional doctor, the first thing I said is, "We need to do a stool test." And she laughed, kind of embarrassed, but we ended up doing a stool test. We did an organic acid test. We did a breath test, and lo and behold, we discovered she had SIFO, small intestinal fungal overgrowth, SIBO, small intestinal bacterial overgrowth, markers of inflammation and other dysbiosis, and leaky gut. So as you can imagine, we proceeded to treat those conditions. We added polyphenols. We put her on an anti-inflammatory, allergen-free diet. And within a several-month period, 90% of her anxiety, her obsessive thoughts, and her insomnia had gone away completely. Now, that shouldn't surprise you because the topic today is the gut-brain connection. But that case demonstrates the power of our microbiome to communicate with our brain. And today I'm going to dive into the mechanisms. We all know this to be true, but today I'm going to go very quickly through a lot of good information about how this actually happens, from your gut to your brain, and your brain back to your gut through the vagus nerve. So join me as we dive in. There's four main concepts I'll talk about today. One is this bidirectional communication I introduced in Deanna's case, and that's the way the hormones that are produced in your gut and the bacterial metabolites like LPS can actually talk to the brain. So there's this bidirectional communication, and that's the key that we didn't know years ago. In fact, if you look up the word microbiome, I was a graduate from medical school in 2003, and it was only around that time that the microbiome actually appeared as a word in a literature search. And now there's hundreds of thousands of research papers on the microbiome, and of course, it's a topic we all discuss every day if we're doing integrated and functional concepts. And then this other way that it communicates is from the brain down to the gut through the vagus nerve. Neuroinflammatory regulation, and then short-chain fatty acid production. We're going to talk about the power of propionate and butyrate and these other short-chain fatty acids in healing a permeable gut, and the power of food to increase your short-chain fatty acids. And did you all know that short-chain fatty acids can also produce GLP-1? So there's ways that we can actually modulate even our appetite and our mood. And then the impact of mood and mental health in the gut. So this bidirectional communication, as I mentioned, the vagus nerve acts as a major highway for this. And it also goes from the bottom up, and that would be through the microbiome, the production of things like GABA, serotonin, melatonin, and other neurotransmitters. There's also ways that the immune system is interacting with the gut. There's literally one cell layer thick from the gut lumen to the immune system where the blood lies. And so that barrier is very thin, and if there's any degree of permeability, there's going to be leakage of the microbial contents into the bloodstream, and then this immune system either creates a fight or flight response or a calming response, and that goes on to affect the entire system. So it's a really big deal. Years ago when I started functional medicine, we would test people for leaky gut. And as you heard in my story of Deanna, I didn't mention leaky gut testing because now I assume that every single person who walks into my clinic has a degree of leaky gut. We live in a toxic world, and this creates an insult to our intestinal lining, those enterocytes, and it leads to permeability in most people to some degree. This is just a demonstration of the healthy on the left side and how the ACTH and hypothalamic pituitary axis acts through the brain to the gut microbiome and back and forth, and how a damaged immune system, inflamed immune system, inflammatory cytokines can create that loop back to the brain. And a balanced microbiome, healthy diversity. Diversity is king. When I talk about the gut, I'm always talking about diversity is king because we need to have a diverse microbiome because that regulates these chemicals that speak to the brain. This is an example of all the many ways that gut can produce GABA, short-chain fatty acids, serotonin, things like IL-6 and IL-10. And if you look at the literature for IL-6 and its associated conditions, there are thousands, and depression comes up many, many times in that literature with the connection between elevation of IL-6 and depression. Now, it's interesting. I was talking to a friend earlier today about cytokines, and cytokines have their place. They are our immune system's protection. So these things we often label IL-10 as good, it calms the immune system, and IL-6 is bad, it creates inflammation. But the truth is they're there for a purpose. It's when the runaway train happens, when that immune system gets overactive, and there's no stop, that it becomes a problem and creates collateral damage. Short-chain fatty acids, I mentioned, the gut ferments fiber, and then this fiber produces short-chain fatty acids, including GLP-1, which can inhibit our appetite and change our weight composition. And short-chain fatty acids are really crucial. This is why, if you look at the data on diets, whether it's a Mediterranean diet or a plant-based diet or a paleo diet with fiber, everything that will increase diversity of microbiome, which is most of the types of fiber, the soluble and non-soluble types of fiber, will have an effect on fermentation in the colon, thus producing things like butyric acid, which is one of the most powerful short-chain fatty acids that we know. And these things will calm inflammation. They regulate, as I mentioned, the IL-6 production, the TNF-alpha, and they can actually upregulate T cells. And if you think about T cells, Treg cells are like the bouncers in the bar. They're the ones that say, hey guys, calm down, don't overreact. This is not a fire. And the Treg cells will calm down an overactive immune system, which is often at the root of depression, anxiety, and insomnia. And as you can see, just another slide pointing out all the different ways that diet, exercise, health of your state of health, your mood, your stress, and your gender affect these neurotransmitters. And then these things can affect biofilm formation, microbial growth, lack of diversity, and short-chain fatty acid production. And mood and mental health, of course, are connected to the gut microbiome. The gut microbiome can actually produce things, as you saw in the previous slides, like norepinephrine, epinephrine, cortisol, insulin. And these hormones and neurotransmitters act from the gut to the brain. Many people forget that the gut is like the second brain. And that's why many, many times in my career, I've had a college student come in with depression or anxiety or ADHD. And one of the first things I'll do is tell them they need a stool test. And again, they always kind of sigh and groan because what 21-year-old male wants to do a stool test? But they always find there's value in that assessment. And the route is this vagus nerve through tryptophan metabolism, immune system, and microbial metabolites such as short-chain fatty acids. It's interesting because you often see a correlation with IBS and depression. I think the statistic is about 32% of visits to primary care providers are due to IBS. And many of those patients will also have coexisting depression, anxiety, insomnia, or even OCD or ADHD. So these are absolutely connected. And I don't know if any of you have, many of you have been practicing a long time, some of you are maybe new, but when I was new 20 years ago to functional medicine, we were always told start with the gut. And it turned out to be true and valuable because starting with the gut, you have so much ability to change the whole, not only the microbiome, but the metabolic system, even the weight and body composition of a person, and for sure the brain, the sleep, the mood disorders as well. This talks about how high GABA levels obtained by this Lactobacillus brevis make this probiotic strain a candidate for potential dietary interventions. And now you're starting to see probably even some of the companies that we have out there have these new lines of psychobiotics. And what they are is probiotics that have a certain claim that they're affecting the mood through the microbiome. Now, I would caution you to go forward with any one strain of probiotic as a magic end-all be-all, because it's much more complicated than that. We need that diversity. We need plant-based foods to increase fermentation in short-chain fatty acids. And we really need a much more diverse approach than just one single probiotic. So the vagus nerve, as we've heard probably all day long today, has an anti-inflammatory effect. And this is why you're now seeing so many vagal nerve devices, breathing exercises, and even the work that James just shared with us, because toning and improving our vagal nerve function has a profound effect on our mood and our gut microbiome. Now, I'm not a fan of just using devices because we're missing the point. If our lifestyle is that stressful, I think devices can be helpful, but really it comes back to movement and breath work and full embodiment and dance and all of these things, and exercise, the things that we do to actually change the vagal nerve from the inside out. This study demonstrates that Bifidobacterium akkermansia and Faecobacterium brzezinski contribute significantly to suppression of pro-inflammatory markers. Now, it just so happens that Faecobacterium brzezinski and akkermansia are keystone strains, which means if you see them on a stool test, by nature, they increase diversity. So there are some strains that when you see them on a stool test, you're going to automatically know that that person either probably has a diverse microbiome or doesn't. And some of them in particular, like akkermansia, are absolutely key. So the vagus nerve also is involved in promoting neurotrophic growth factors. So this comes into play with any of our neurodegenerative diseases or after concussion. And having that healthy gut microbiome is key. You also see this if you were ever a doctor or a resident in the ICU and someone had a surgery or concussion, they would often give PPIs because there was such a connection between the stress and creation of a more permeable gut, and then that dumping of the metabolite that we'll talk about in just a moment, which is called LPS, lipopolysaccharide. And that metabolite, if it gets dumped into the bloodstream, creates a whole inflammatory cascade. And if you think about it, this hit me about 10 years ago. Remember when you were back in medical school or residency and you saw the patient who got septic after surgery or septic after some procedure, and they were in the ICU, they were cardiogenically shocking, their blood pressure was 70 over palp. Think about it. Most of the time, unless it was a specific wound infection, this is an example of the total dumping of the gut contents into the bloodstream and creating a hypogenic shock. And when I realized that, I realized how powerful the gut microbiome, how powerful LPS is, and how dangerous it is when we have permeability that's not controlled. This talks about Lactobacillus rhamnosus and how it affects BDNF, and there are many studies of different strains of probiotic that can increase BDNF. So let's talk just a little bit about microbiome and mood. I have some fun little statistics here for you. Germ-free mice, meaning mice that had no microbiome in their gut, showed an exaggerated stress response that was normalized after their guts were colonized with probiotics. There was another study I'll just describe very briefly where they took rats under a stressful condition. And for rats that's swimming without any walls to hold on to, so they just swim indefinitely, they're treading water. And these rats that were in the study, half of them had their vagus nerve clipped, and the other half had an intact vagus nerve, and they were given pre-treatment with Lactobacillus rhamnosus. The ones that had the pre-treatment with the probiotic and an intact vagus nerve swam twice as long as those that did not. And this study was gone on to confirm that probiotics like Lactobacillus rhamnosus actually increased our ability to tolerate stress. And now we know some of the reasons why, probably from the maybe attenuated cortisol response or that HPA axis interaction with the probiotic and the vagus nerve. And this other study shows a probiotic strain called Bifidobacterium longum, and this was helpful in managing stress response in humans. There's two particular psychobiotics I use frequently in my practice, and they both contain that Bifidobacterium longum, and one is for stress and one is for sleep. This pathway I could talk a whole 30 minutes about, but I promise I won't. It's really important. This was an aha for me, just like the sepsis was about 20 years ago, when I realized that upregulation of kynuric acid, and again, I'm sure you've heard other speakers talk about this, went down the path to quinolinic acid, which is neurotoxic, neuroinflammatory, and an agonist of the NMDA receptor. This is important because when you see quinolinic acid in a urine organic acids, you know this patient is massively inflamed and has neurological issues. And you have to go back to what was triggering that enzyme. There's an enzyme called IDO, and that enzyme can be triggered by parasites, dysbiosis, infections, salmonella, shigella, and many other things, including tick-borne infections, and even mold, and upregulate that process and create a neuroinflammatory condition. And that needs to be addressed if you ever find that on an organic acid test. This is fascinating because it showed a study with autistic children who were treated for C. diff. If C. diff, Clostridia difficile, is actually more prevalent in autistic children. I treat it frequently. And the combination that I frequently see in my autistic panels are excess candida or some type of yeast with Clostridia. But when you treat this with vancomycin, which is one of the older drugs used for Clostridia, you see an improvement in the behavioral symptoms and communication. And I have seen those ahas with the mothers of the children who weren't speaking after I have treated their gut dysbiosis. And the mother comes in with tears streaming down her cheek saying, "My son said his first word." And it was a week after he took that antibiotic. And if that's not magnificent, and the reason we do what we do, I don't know what is. Those are some of the most precious moments and memories that I have in clinical practice. And it starts with understanding how the microbiome affects the brain. This talks about attention deficit, so great slide after James' lecture, and the connection between different microbial features and ADHD. And as you can imagine, if the gut's producing excess dopamine, deficiencies in norepinephrine, excess cortisol, and again, it perfectly hinges with James' lecture because you saw all the many ways that those different changes can affect our brain and cause difficulty with focus and concentration. And then these are just fun facts. I love them. People with larger social networks have more diverse microbiome, assuming because they interact with more people. And if you've ever seen those studies about hotel rooms and the microbiome, it's enough to fascinate you or totally gross you out. Because as we stay in these hotel rooms, the microbiome of the room actually changes based on the person there. It's kind of like the Pigpen cartoon from back in the day where he had that little cloud. That, I think, actually is very realistic nowadays. Adults who traveled frequently ate more diverse foods, more foods with naturally occurring probiotics, or were breastfed as infants had a more diverse microbiome. And for some reason, women's microbiomes are less diverse than men. And dog ownership in early life contributed to a more diverse microbiome. I'm sure that's because they often lick our faces. Okay, so I would be amiss if I don't do a little bit on metabolic endotoxemia. This, to me, is such a root of complex chronic disease, obesity, diabetes, heart disease, many, many metabolic syndromes, but you may not know it's also connected to the brain. So I'm going to go through just in a couple slides and tell you how. So what is endotoxemia? Endotoxemia is a lipopolysaccharide, a gram-negative bacterial coating that postprandially for every single one of you in this room leaks into the bloodstream after we eat. In studies, it's measured as 4 or 5 hours postprandially, and it's 4 times the normal baseline limit, and that is considered metabolic endotoxemia. But all of us, to some degree, have this leakage of LPS after we eat. Have you ever had a patient who says, "Doc, I feel fine until I eat. And then I've got brain fog, I feel crummy, I can't focus"? That's endotoxemia. And you heard just briefly about my history with cancer and Crohn's disease, and the cancer, the chemotherapy I had actually massively increased intestinal permeability. So it's no surprise that I developed Crohn's disease 6 months later, and it took me a long time to heal from that. But even to this day in my clinical practice, most of the time, I eat very little during the day. I eat before and after. And you'll find these people tend not to eat big meals if they have to focus and concentrate. And that's a key to the diagnosis. So this is one of my favorite diagrams that just shows this on the right side there, on your left, there's that blue mucosal barrier. That's formed from things like Roseburia, Akkermansia, Faecalbacterium and Brusnitzky, all those keystone strains. And that protects us from the permeability where this LPS starts to leak in and create breaches in the barrier. And then you see on your right what happens when we have overgrowth, LPS, and poor barrier, and this leaks in and creates an inflammatory response in the immune system. These are just a list of many, many causes, not exhaustive, of leaky gut. So we have things like SIBO, like our patient Deanna had, celiac disease, protozoal infections, frequent and excessive NSAID use, toxic exposure, food allergy, chronic alcoholism, strenuous exercise. There was a study on Ironman athletes, and during their training, they absolutely had an increase in intestinal permeability. And there's this interesting thing, and I always get questions when I show the data. Regular exercise improves intestinal permeability, so things like yoga or aerobic activity. But when you have these extensive, strenuous training programs, they increase intestinal permeability. So what I do is I either don't treat the gut while they're in training, or I give them things like glutamine or bovine immune globulins or spore probiotics. Even vitamin C and glycine have been shown to be protective. So what is manifestations of LPS? This list is crazy because it includes so many things. So leptin resistance, chronic constipation, mood disorders, depression, cognitive decline, memory loss, anorexia, anxiety, chronic pain, Parkinson's, and that would include all neurodegenerative diseases, hypogonadism, so this is a big one, low testosterone in men and women. Think about LPS in that. You probably have never thought to think about LPS as a root cause of hypogonadism. And then autoimmunity, of course. So this is a big list, and I didn't even include cancer and heart disease and obesity and diabetes. So this is, when I really understood LPS and the role it plays in so many of our patients, it was, again, such an aha in my practice because it underlies so much of the disease that we treat, which means back to my original premise, if you start with the gut, you can get a big traction on your patients by improving their intestinal permeability. These are just several studies I'll go through quickly about LPS. This initiated the sickness behavior that we see with malaise, fatigue, chronic fatigue, ME, CFS kinds of patients. LPS could be at the root there because there's quite a few studies showing the connection. And this is talking about LPS as a severity and subset of depressive symptoms, especially anhedonia. So those who are like, I don't really care about anything, I have no interest in life. There was several studies that linked the LPS endotoxemia to that type of depression. And then finally, this showed that LPS stimulated inflammation, again, IL-6, TNF-alpha, all those cytokines we talked about, with increased odds of depression and anxiety. And LPS stimulated immune inflammation was associated with more severe depression and anxiety. And again, all you need to do is go to PubMed and look up IL-6 and depression, and you'll see the many, many studies that talk about this. And then probiotics may improve anxiety. I mentioned the Bifidobacterium longum earlier. This has quite a bit of good evidence, and in my clinical practice, I have found it to be helpful. Now, to be honest with you, the psychobiotics that I've chosen to use in my practice, they also have things like Chinese skullcap or theanine. So I think that there's a combination effect of these herbal and amino acid ingredients with the probiotic, and maybe not just the probiotic alone, but again, in my experience, they seem to do at least something for the patient's symptoms. And then testing the microbiome, I mentioned this patient, Deanna, when she came in, and this college kids that I have with mood disorders, we always start with a stool test. One of my favorites is the GI 360, doctor's data. And as Kiki mentioned, they're paying to give you free books tomorrow at 11, so be sure and stop by and get your book. It's all free, and thanks to them. But this is a great test because it does not only PCR, but stool culture. And I like the combination when I choose stool test of both of those pieces of the puzzle. And of course, indications, mental health is a big one when you're looking at stool testing. Now, I also mentioned I did organic acids. That's another one of my very favorite tests to do. And it takes a little while to learn, but it's so powerful. It shows you neurotransmitter levels. It shows you 8 or 9 metabolites of fungal metabolism and yeast. It shows you metabolites of Clostridia and bacterial overgrowth. And it shows you metabolites of B vitamins, glutathione, tryptophan metabolism, kynuric acid, and quinolinic acid. So I find the organic acids to be one of the most powerful tests that I use in clinical practice. Okay, so let's end with some treatment options. If we have time, the bonus section is the emerging research stuff that has just come out in the past several months, but we'll get through treatment and see where we're at with time. So increasing diversity. Now, years ago, how many of you have been in functional or integrative medicine for more than 10 years? A few of you. I've been over 20. And back in the day, we were sold a bill of goods by the companies. And they said, our probiotic has 500 billion and 10 strains. Our company has, 800 billion and 12 strains. And they were out competing one another based on number of strains and number of probiotics. And we all bit hook, line, and sinker. There is no evidence that more diversity in the probiotics is increasing our diversity in our gut. And this has been a big thing as I've taught hundreds of gut lectures, understanding that food is the medicine for the diversity, not a probiotic. Now, lately, we've seen that some certain spores can maybe increase diversity slightly, and some of the new things on the market that are prebiotic fibers and phytofibers and polyphenols. But that makes sense because they're from food. They're from like pomegranate extract and these things that actually increase diversity. So this is a really important concept because you're only ever going to get increased diversity from food. And a diet lacking diversity and lacking fibrous plant-based foods will never increase diversity. In fact, over the years, I've come to say that sometimes those probiotics, those 10-strain probiotics that patients are on for several years, maybe they're increasing monoculture by just accentuating those specific strains versus the millions of strains we actually have in our gut. And then what else can we do? So we can increase diversity by time-restricted feeding. Again, back to my point about someone who says they feel better when they're not eating, they're fasting. I believe one of the powerful things about intermittent fasting, or any sort of fasted state, is not the fasting, it's that you're giving your body and your bloodstream a break from LPS endotoxemia. And it is powerful, there's evidence, but I don't think it's so much about the fasting, I think it's about the microbiome. And we can reframe that. Increased fiber intake, macronutrient diversity, and polyphenols are so huge. My other favorite topic is mold. And one of the things we keep finding with mold is polyphenols can be binders as well as clay and charcoal. So we use them a lot in our clinical practice. Supplementing like glutathione, glycine, glutamine, these are all precursors of glutathione, which is our master antioxidant. Vitamin C, zinc, crucial for the barrier of the gut. Vitamins A and D, colostrum, and bovine immune globulins. We know from the data that colostrum and bovine immune globulins will passively bind things like H. pylori, candida, salmonella, Klebsiella, these things that we don't want in the gut. And we need to address the adrenals, especially if you see a low SIG-A, that's secretory IgA, on your stool test. The very first thing you need to have a conversation with that patient is about their stress levels, because stress will suppress your gut's immune system, and if you have no SIgA, you're going to have a whole animal kingdom of overgrowth in that gut. Get dirty, eliminate chlorine cleaners, eliminate antimicrobial products, get a dog, and protect from EMFs. These are some other things that you can do to change your exposure. Evidence-based interventions for LPS endotoxemia. I have slides and slides on all of the evidence, but each of these has multiple studies, starting with physical exercise, as I mentioned, in moderation. The recommendations are 150 minutes a week, and that is the bare minimum of aerobic activity. And curcumin, sulforaphanes, resveratrol, EPA, DHA, bifidobacteria, and spores. And then I mentioned increasing plant-based food, avoiding sugar and highly processed foods, and increasing these dietary fiber prebiotics like onions, leeks, garlic, artichokes. All of these things are wonderful, fibrous-rich foods. And if you start to watch a bunch of the products that are coming out, there's these new smart fibers. And tomorrow in my lecture that I'm giving in the other session, I'm going to talk a lot about the details of the different types of new fibers, because I think we're going to find some great new stuff. But you can never replace food, just like you can never replace exercise. These things are always going to be foundational to healing. And intermittent fasting, as I mentioned. Okay, last slide here. This is my personal favorite. Some of these you've seen before. But if I'm looking at a patient like Deanna, I'm going to give her spore probiotics, bovine immune globulins. I love CalMag or sodium butyrate. as a source of butyric acid. PRMs, those are pro-resolving mediators. They're downstream from EPA and DHA, and they can be powerful anti-inflammatory mediators. They're one of my new favorites, and so many of my patients who have mast cell activation, mold issues, chronic pain, I'm putting them on high-dose pro-resolving mediators and getting great outcomes with pain and inflammation, and gut permeability, of course. Polyphenol-rich foods, fiber-soluble and infibrable. Berberine is an old standard that's really good metabolically. It kind of acts as a natural metformin through a similar pathway. Digestive enzymes, quercetin, and curcumin. Okay, and I think we're time. So you would get emerging research in your slide deck. So that'll just be we're at time, right? Okay. But the main thing is someone like Deanna comes into your clinic, and your first thought is maybe reach for a benzodiazepine or an SSRI. Clearly, in her case, that didn't work. And if you truly want to change the world and practice root cause medicine, you're going to start with the gut and look at the microbiome and do these kinds of interventions to change that person's entire life. And the great thing is it's simple and it works. Thank you.
Dr. Jill Carnahan, thank you so much. That was brilliant. Thank you.